Welcome everyone to our WinBack webinar, Cutting Edge Sports Medicine, 95 Days in the WNBA Bubble. My name is Tracy Orrell and I'll be your WinBack host today. Our mission at WinBack is to restore movement by providing disruptive tissue recovery and pain management solutions. WinBack is about bringing a platform of technology, education, and community all together to ultimately contribute to changing patients, and in this case, athletes' lives. This webinar will hopefully give you a good example of how WinBack can easily be incorporated into your practice and enhance your techniques as clinicians so you can provide your patients with the best possible treatment experience. As far as the logistics today, everyone is on mute. You can certainly ask questions in the chat and I will relay them to the presenters. Please give us a description of your name and your specialty, and so we know how to tailor your questions. And also in honor of Super Bowl weekend, please let me know who you're cheering for. Today's webinar will be recorded and accessible all next week on all of our platforms. With that, let me introduce our speakers today. We have our guest speaker, Laura RAMUS, who is the medical director of the Las Vegas Aces, and Angela Batha. Angela is the CEO of Henley Health Group and clinical director of Physiolistic in the UK, where she has worked as an international trainer and physical therapist for over 20 years. Originally South African trained, but has made the UK her home. Her reputation sees her work with some of the top orthopedic surgeons in the world from Oxford and London, and treats patients from all walks of life, from Olympians and Oscar-winning celebrities. Her innovative approach to pushing the boundaries of what is possible in musculoskeletal therapy introduced her to WinBack a few years ago, and now is an international trainer for us, working with top professional sports teams, including the Chelsea Football Club. Her clinic has all the latest technology, diagnostic ultrasound, WinBack, focused and radial shockwave, neuromuscular electrostimulation, and ice compression therapy, for which her team combine with manual therapy and exercise and try to find the best and most perfect recipe for optimal healing and patient satisfaction. Now I'm going to turn it over to Laura. Laura is our guest speaker, and I'm really excited for Laura and Angela both to do this webinar with us. I've had the opportunity to work with both of them and learn from them, and they are some of the most intelligent and humble women in the industry. So with that, Laura, if you could take it over.
Thank you so much, Tracy, and everybody, welcome. First of all, thanks for taking to give us an hour of your time here today to off of a Saturday to talk about sports medicine, Angela and I. We want to really look at this as I believe that we have a finite number of minutes in our life, and you guys are all giving us 60 minutes of your life, and there are so many talented people on the webinar today. I'm hoping we can make this interactive and share each other's talent, and at the end of it, be better clinicians for this 60 minutes that we're taking from our lives here today. So that's the start of this whole thing. Like many of you, I've dedicated a lot of my life to sports medicine. I'm entering my 34th year as a physical therapist. I started out as a PT, and then I had the great honor back in 1989 of being accepted into a fellowship program with the renowned Dr. James Andrews, and studied with Kevin Wilk, and through that fellowship was able to become a certified athletic trainer through the University of North Carolina. From there, I'm a Detroiter, so I've always found myself back in Detroit throughout this 34-year career. So whether I was working with Henry Ford Health System or currently I work with the Detroit Medical Center, I've been involved with our pro sports teams or the athletes and those logos below there. But the majority of my life in this whole rehabilitation sports medicine has been with the female athlete, and specifically the WNBA. It all started in 1998 there for me. My first 12 years were with the Detroit Shock, where I can see behind me, I have my bad girls still up here. We had 3 WNBA titles in that 12 years under our head coach, bad boy himself, Bill Lambier. After we were sold, same time the Pistons were sold in that 2009, 2010 time frame, I moved on to the New York Liberty, and had the great opportunity to actually work and train out of that same facility where the Knicks are and where the Rangers are there in Terrytown. From there, I've moved. Now I'm in Las Vegas. Work with the WNBA there, where, as she indicated, I'm the medical director. This is my be going into my 4th season with the Las Vegas team. And I do definitely have this bass backwards because I'm right now in northern Michigan, where we just got a foot of snow in the last 24 hours. And then I spend the summer times in the Las Vegas desert. Between those time frames, I did have the great opportunity to go into the professional tennis tour for 2015-16 and learn from physios like Angela, the physios from Australia, physios from New Zealand and Austria and Spain and Ireland and the UK that are just amazing manual therapists, and brought that skill set back into the WNBA. And of course, like many of you out there, also had the honor to be a trainer for an athletic trainer with the Olympics back in 1996 for me in Atlanta. So that's kind of where I come from, or where my sports medicine experience has been. Today, I just want to look at sharing those experiences in the bubble that I just had, because we talk about all those things in 2020. Nothing compares 2020 to all those experiences. This is just such a unique year that we just went through, and a unique year that we're approaching even in sports medicine right now as we move forward for 2021. So Angela and I want to just share how you can take your manual skills that you're using in your rehabilitation setting and your exercise, and you can take it to a cellular level, literally how you can add this technology, or how I did it in the bubble itself. So, a year ago, it was just about this time that we were starting to get some feel if something wasn't right going on. It was actually a year ago that I actually bought my first win back and became trained in it, and knew that, okay, going into 2020, I'm going to utilize this new technology, this my rehab system. It's going to be new for me. So in that whole situation, that became a screeching halt, right, for many of you guys out there, whether you're in hockey, whether you're in the NBA, all of our NCAA, every sport came to a screeching halt in March. And for us, it was right at the time we were supposed to start our season. WNBA starts in April, and then we go through the summer and accumulate with playoffs usually in around October. So right when the COVID hit, we were trying to bring our players back from overseas. A lot of them play overseas, and put our team together. And it was July 1st when we started our bubble. And that bubble for us was a true bubble. If you've been to IMG Academy in Bradenton, Florida, a beautiful facility, but we were truly there, locked into that spot, stayed in a hotel, either a hotel or one of the apartments right next to the hotel, ate at the same training table that was provided for us. There were 4 basketball courts that all 12 teams that were there had to practice on a practice schedule. You only got certain time that you could be on that court and length of time. We had 1 strength conditioning space that we all had to share. And again, it was all scheduled, and it varied from day to day. So that variability, there were so many things that were different and so many difficulties that I knew, number one, there were going to be these physical problems that we're going to deal with, these deconditioned athletes, first of all, that were coming in that couldn't do anything, because of the lockdown. I remember one of our starting guards said, she's from Indiana, and she said, Laura, it's May. I'm trying to just get onto a basketball court. I can't do it. Everything's closed. So I went to the park, and they even have chains on the nets in the park. I can't even shoot at the park. So it was a challenge when those players showed up from a deconditioning perspective to begin with, obviously. And then as soon as we showed up, it was 3 days of quarantine in our hotel rooms. And you couldn't even go out. I mean, they literally put your food at your doorstep. You couldn't even go out. So it was, coming up with conditioning programs that they could do in their rooms. And then once that 3 days was lifted, boom, you had 10 days of training camp. So show up, get out of your room on Friday, and then start training camp. So musculoskeletal injuries were going to be a problem that I, was trying to just put a plan together. And then the psychological, once I got in that bubble, I said, man, these are the 2 things that at the end of this, it doesn't matter how talented your team are. If you can stay healthy through this thing, and you can stay mentally in this bubble, not leave it or be able to really perform in it, you're going to be in the finals. And then from there, throw the ball up, let the best team win. And that's literally what happened with our team. We were definitely not, we way overachieved for that bubble. We were not the most talented team in there. But we made it to the finals. And at the end, the better team did win. Seattle was a more talented team than we were. We had our backup center was still in Korea, couldn't make it here. Our starting center couldn't pass the COVID test to even make it into the bubble. So there were so many of those challenges going on, but the bottom line is we were able to put together a medical plan that kept our players healthy. We literally, from the day that the regular season started through to the end of the regular season, we did not have one player miss a game or a practice during the regular season because of an injury. And there were major players going down with major injuries, whether it be ACL injuries, tears of Achilles tendons, shoulder dislocations, grade 3 ankle sprains, again, to the #1 draft players. Just huge injuries that occurred out there throughout the bubble, and we were able to escape those. Again, some good luck, but some really good planning on that end of it. So then, what, in this whole thing, we all have our rehab systems, and that's the beautiful thing about this, is that we all come from unique backgrounds. We have our physiological and basis in which we do our treatments, and that's not going to change. So as we're going through this today, you're just going to apply what you're already doing, and maybe pick up a couple new pearls, but you're going to apply this win-back physiology and some of our knowledge to what you're already doing, in your rehab system. So, for us, when I got into the bubble, I said we had two medical people there, myself and my other physical therapist, athletic trainer, and I said, we have to stay with our rehab system. It's established, it works, and we're going to include win back, and we're going to include brain tap in it, but we got to keep this here. And that system's based off of some great skills that manually that we are myself and my the physical therapists I work with have. It's based off what the players, need and want. That's part of it. And of course, it's always evidence-based. It's always based off of science and the research that's out there. So that's always what we're constantly bringing into the picture. And so when you're looking at your rehab system, what is it about? We're just trying to accelerate healing. We're trying to take somebody from inflammation to proliferation to that remodeling phase as fast as we can, whether that's an acute injury, whether that's something that's chronic, or whether it's that athlete that comes in and their body map is just a mess, and we're trying to, correct their movement pattern and prevent them from injury and give them better performance. It doesn't matter. That's what it's all about. How quickly can we do that? And then, as I tell junior athletic trainers all the time, it's not about how fast you get somebody back on the field or the court. It's, do they get to the level that they were previously, and do they stay there? It doesn't help to get right back and then be injured the next month or even the next year. Can we keep them there? And that's where this whole approach, when we start to talk about changing cellular physiology while we're doing our manual therapy, while we're doing exercise, really, I think is going to be able to take us to that end range, not only quickly through it, but keep athletes in the game and keep them healthy with that maximum healing. So here's our approach. I look at three major components. Again, I look at that manual part of it. Again, skills that I've learned, starting way back in PT school in 1987, all the way through to today. I use, whether it's manipulation, mobilization. Here, I'm a huge user of instrument-assisted soft tissue, myofascial decompression and cupping, dry needling. And what you'll find is that we're going to take all those things and make them even better. We're going to be able to take our hands and then not only have them do the manipulation and get all the positive benefits from a manip, but at the same time, getting that energy from the cellular physiology, the cell-based practice going into that at the same time. So it's a win on that end of it. So you've got your manual parts of your therapy, your rehab program, you've got your exercise. Everybody's got their different ways they body map. Everybody's got their different corrective exercises or approaches to performance training. We're not going to change it. You're just going to incorporate what you're currently doing and add on to it this cellular effect. And then finally, we bring all that together with this technology. And I've already had been using before 2020, laser and shockwave and complex, those components. And what I did add in new this year was a win back, and we're going to talk a little bit also about brain tap. So with all that said, I had three major successes. First of all, what I just alluded to, the fact that from the start of the regular season practices, so before training camps, we had a couple injuries we'll talk about in training camp. And then, but from that point, when the regular season started, all the way through to the end of the regular season, which we ended up in first place, we did not have a player miss a game or a practice. And again, that was an amazing statistics. And I think that was really related to what we did with our recovery program. we're getting into some specifics on that. And then I'm going to go over an example of an ankle sprain that did occur, a high ankle sprain that did occur the second day of training camp, but how she made it back for the regular season, practices and games, and then did not miss anything through playoffs, actually. And finally, talk about a player who had, came to us for the first time. I'd worked with her. She had been in the league a lot of years, had torn her ACL 2 years previous, actually right in front of me on the bench when she was opposing us. I was on the opposing team. And she really hadn't made a successful recovery after ACL injury. But, how we were able to take this athlete and get her back not only onto the court successfully for the first time after ACL injury, but to have one of her best seasons of her career. So with all of that, Angela, I'm going to have you go ahead and take it on over and talk about physiology of the win-back system.
Thank you, Laura, and thank you everyone for giving up your morning to spend it with us. I'm really excited to be able to introduce the win-back technology to you. I was introduced over 2 years ago, and I can truly say it has changed my practice. As you can hear from Laura, it has as well. And I'm hoping this inspires you that you might get the win-back effect as well. Next slide, thank you. So as Tracy mentioned, if we just go back one slide there, we have a high-tech clinic, which is physiotherapy and athletic trainers, as you call them, and massage therapists. We see everyone from weekend warriors to Olympians and all ages from 5 to, I think our oldest is 97. And what we really like to do is exactly what Laura was saying, is how you combine exercise, manual therapy, and this technology that we have. And we have a lot of technology. And how do you then get the best results? In a world where Amazon delivers on the same day, people are becoming the same way with their health. They want instant and rapid results. So how do we as clinicians push the boundaries and achieve that quicker? Next slide there, please, Laura. So I like to call it the win-back effect. So in our clinic, how has it changed things? I would say that the great thing with the win-back is 9 out of 10 patients who come through the door, we can use the win-back on. And that's because it integrates seamlessly into what you already do as a clinician. So for example, if I was gonna do massage, then I'd use the win-back with the massage. If I was gonna do joint mobilizations, I include it with that. The same way with exercise. And that's where it's genius, in that you don't change what you do, it just makes you better at what you do. As Laura was alluding to, you then are not only achieving the therapeutic benefits of what your hands are doing, but you also then are getting the therapeutic benefits of the win-back, because it's acting at a cellular level. So I always use the analogy with my patients, saying you're getting 2 for the price of 1. Not only are you getting what my hands can do, you're getting what the radio frequency and the tech-R can do. I have 8 PTs in my clinic. They all love the machine. So we have 3 machines. In an ideal world, we each have 1 because we use it that much. We also find that people actually say, can I have that machine again? And they actually send their friends asking for the machine. So that, we don't get the same with Shockwave and some of the other technology we have. And the other big thing for me is you get a lot of change in one session. So you get what I call wow moments with your patients. So in that one session, you get a lot of movement or a lot of pain reduction. And that for me means we have a lot of happy patients, and that's helped me have a thriving practice. Go to the next one, please. So what does it do? So what is it and what does it do? I suppose the big thing is the 3 big things that you can take away that it'll help you with. It's very effective at removing pain. It restores function quickly as well. And then the big thing that helps us all is it regenerates tissue. So what is it? So it's a radio frequency or a monopolar high frequency current, which is alternating. This is delivered through 2 modes, either resistive or capacitive. And that's actually where the name tech-R therapy comes from, the transfer of energy, capacitive and resistive. It's just an acronym for that. Now, the different modes allow us to get different depths, but also work on different tissue types. And then, as you can see underneath the different modes, we also have all these attachments, which also allow us to integrate it into whatever modality we are doing. which also makes it fantastic as a clinician, because you can adapt the machine to what your needs are and what you were going to do anyway. Next slide, Laura, please. So what does the high frequency current do for us? And this is the important physiology part of it, is that it actually does, it activates and consolidates the natural processes of tissue repair. So are we accelerating it, or are we turning it on, or are we making it happen, and are we making it happen better than it would have done normally? That's what we're trying to do, and that's the sort of holy grail for us, is we want injuries to heal well, but also quickly. Because it's no good it's quick, but actually the integrity of the tissue is poor. The nice thing with WinBack, not only is it quicker and optimized, the integrity of that tissue is very, very good as well. Next slide. So if we look at how do we achieve this, so TECAR therapy has sort of 5 physiological effects that are of therapeutic benefit for us as therapists, and these are increasing the cellular metabolism, stimulating collagen and elastin. There's a diathermic effect, there's analgesic effect, and increased circulation and lymph drainage. Now, all of those as a package together just are the perfect adjunct for any tissue treatment we do. I'll briefly discuss each of these. So how does it increase cellular metabolism? Well, we've known since the 1820s that if we apply a current against the tissue, it has an effect on the ions within our body. We have positive and negative ions. So applying an alternating current makes that a flow of ions happen, which increases the cellular permeability. That flow of ions then is bringing good nutrients into the cell, taking the waste products away. So you really are stimulating cellular metabolism. And if you think of healing, what do we need? We need the cells to do that metabolism so that we can encourage that healing. So that's an important part of it. And the WinBack definitely helps stimulate that early on in the process. Next slide, please. So the other thing that is really helpful, that the WinBack, it has been shown that when the current, the high frequency current, actually attracts and activates fibroblast cells. Now, the fibroblast is what I call the physio or the PT or any therapist's best friend, really, because it produces all the building blocks of healing. So it produces the collagen, the elastin, all the extracellular matrix and everything. So we need fibroblasts to optimize that healing. We need fibroblasts for good healing. And again, the body will eventually turn these on, but with the WinBack, we can make sure a lot are turned on, and they turned on early. I have the next slide I'll just show as well, is just to illustrate this. Now, this is from a dermatological journal, and they targeted TECAR therapy at the skin. And it just allows us to see the effect of TECAR therapy on the skin. And the baseline picture there is before they started treatment on the skin. They then did 6 treatments over 3 months on the skin. And then the final slide that you see, the post-treatment one, is then 3 months later with no further treatments. So you can really see from that the thickness of the skin got thicker. The collagen structure underneath is much more organized and thicker, and you can definitely see more blood vessels and everything. So you can really see the positive effect on the skin. Now you might say, well, that's skin, that's not, but what we could then translate from that is that imagine what it's doing to your tissue, to an injury deeper down, and if we target the TECAR at deeper tissue. On the next level, that what TECAR does very well is improve circulation. We know that the WinBack causes a flow of ions, and the flow of ions knocking each other, and that generates a heat and a resistance. Also, the tissue that the current flows through causes some resistance, which also generates heat. We can use controlling the machine, we can make that temperature either much lower or really high, and therefore we can stimulate circulation at multiple levels, both at a capillary level and even to the bigger vessels, depending on the heat we generate, because the body will increase circulation to try and reduce the temperature of the tissue. But another really important bit is that it can also affect and improve lymphatic drainage. So stimulating the lymphatic nodes can actually improve that lymphatic drainage. So for us as therapists, getting rid of that swelling, all that sort of thing post-injury, that's really important. The same way getting increased blood flow, bringing in oxygen and nutrients to the area is just as important too. And at another level, so the next slide, is where I find it WinBack really powerful in the beginning, is it's very powerful analgesic, both instantly with the, sort of pain gate theory, and then also longer term, you get it through the endorphins. It also interferes with the nociceptors at a synaptic interference level, so that you get quite rapid pain relief. And that then allows you to restore motion and movement, and then they then have further pain relief because they're moving better. So for a lot of why you can achieve more with the WinBack is this very powerful analgesic effect that it has. And then, as well as that, on the next, it's also very powerful at creating heat, as I said, in the tissue. Now, this heat is different. It's caused by the movement of ions and the resistance of the tissue. But the important part of this heat, it's not a superficial heat like you put on a hot pack. This is an endothermic reaction. So there is the movement of those ions and the resistance of the tissue. So it's really deep in the tissue. And that's one of the things that I find with a lot of my patients, is that they'll go, actually, that's really nice heat, because it's so different to something being placed on superficially. So you can really get to those deep, tight muscles as well, and allows you to be more effective with your hands. The great thing as well, the next slide there, Laura, please, is that it's all rooted in science and research, WinBack. They have over 200 studies on TECAR therapy, and so like the likes of myself and Laura can be reassured that we are basing this on the science and research. Next slide, please, Laura. I've put this in as my final slide on it, and this is where what I think is the magic of it. It's incorporated in all aspects of the sports medicine journey, from prehab all the way through that acute injury, through to the chronic injury, to even when injury prevention. And I think there's not much technology out there that we use as therapists that has that ability to do that. And I just think it's the perfect adjunct to any therapist, as I say, taking your treatment to a cellular level as well. So you're doing two things at once. And my question to people is, why wouldn't you combine both when it's not going to change what you're doing? I think on that note, I'll hand over to Laura, and she can talk further on how she integrated it and give us all those examples of how she used it. Thanks, Laura.
Yeah, absolutely. Fantastic, Angela. And what I'll do, Tracy, do we have any questions? We'll try to get some questions in throughout the presentation, so it's just not Angela and I speaking to you guys. Again, we're sharing each other's all of this wealth of information that's on this webinar today. Anything out there, Tracy, that's questions with regards to the physiology that we've gone over so far?
We had a couple of questions come in, but then Angela went into the answer. So I think they were a little just premature in terms of the difference of the diathermic, the heating effect, and how is that being administered, or how is that being created. So
Sure.
that she did answer.
Yeah, and I'll kind of hound in off of that just a little bit. When we talk about there's two different effects that we have when we're applying. We call it CET, which we'll look at a little bit, versus RET, and it's just a matter of which resistance, which ones I'm using. When I'm using CET, as she described, we're superficial, but we're deeper than a hot pack. We're that 2 to 4 centimeters, and we're going to be affecting. You're connected to your fascia system, and be connecting the muscle tissues is what we're really focused on when we're studying it at CET. Versus if I set it at RET, I want to get even, or I can go CET even, and I can get deeper into the muscle tissue, so I can get through the quadriceps, but it's still going to be focused on the quadriceps because that's a really high water content tissue. So that's what the CET works off of. And then you're going to be warming or cooling. You're going to be doing that fluid and your movements for those tissues. If I'm using RET, and you'll see some examples coming up, if I want to get to those more dense tissues, those are tissues that create resistance. So I said at RET, if I want those effects that she just described, whether it be analgesic, whether it be circulatory, whether it be connective tissue, where I'm getting the healing in that collagen tissue from that, again, type 3 collagen, and helping it remodel to type 1. That RET is your dense tissues. It's your joint capsule, so I can have an effect on the joint capsule. So we'll show some examples coming up of how you can mobilize, and you're not only getting the mobilization for the capsule, but you've got that physiology, that energy going through your hands forward to that capsule. Or if I'm working on a ligament, or if I'm working on a tendon, those denser tissues are what the CET will do those same effects to. So there's that little bit of a differentiation. So we'll, again, throughout the whole, we're gonna, if we haven't covered your question throughout the webinar, we'll definitely get it at the end and even offline. So with all that said, Tracy, we're going to go ahead and talk regeneration recovery. I had 3 different examples throughout the bubble that really stood out in my mind. And, you know, as all of you guys have in your programs now, your recovery regeneration programs, they've encapsulated, you know, our load, how much stress each athlete. So it's individualized for starters, and it addresses all these systems: the metabolic system, hormonal system, neurologic, musculoskeletal. And that psychological and environmental one for us, again, in the bubble was huge. And the win back physiology definitely, you know, if you just think about the science we talked about, it affected the metabolic, our neurologic and musculoskeletal system. And we'll show you some examples how you just put that into our recovery massages, how I put that into my instrument assisted soft tissue, how I put that into myofascial decompression or your cupping, or how I utilized that massage before I did my dry needling for recovery. So again, whatever your recovery system is, whatever you're utilizing, you're just going to put that part in. The other piece of the puzzle that you'll see here that we incorporated, that I felt when I said in the beginning, the 2 things that would take you to the finals would be psychological health and musculoskeletal health. We really emphasize the musculoskeletal health, but that psychological part of it, the big piece of the puzzle that I added in this year was something called brain tap. And you see that a previous athlete and this athlete with it on. I had learned about it actually just about a year ago. I was in Kansas City at the new USA, the Olympic Training Center for men's soccer, football. And they had this in their recovery room, the brain tap, and it literally uses light stimulation both for visual and for your inner ear auricle, along with sounds that create different brain waves. And we utilized it, again, if you think about the stress. So, you know, your typical brain, you're stressed out, you're at that gamma level type of brain waves. You know, how do I get that person to alpha, to relaxation? It was amazing what the brain tap did. Or they're all hyped up after a game and they can't fall asleep. And you get back to your room, and again, we didn't have showers, you know, at the arena. It was 2 courts, and you moved everything into the training, you know, into your locker room. It was never set, and then they cleaned it and you moved out. So we had to shower back. So how do you fall asleep when you're finally back, showered, and just ate at 3 a.m. and you've got practice at 12 p.m. because you can't control your practice schedule in the bubble. Literally, you put these things on, and we had an athlete, we also used the Aura Ring. We had an athlete who was only getting maybe 5 minutes of deep sleep a night. Put one of the brain tap on with that delta brainwave, that deep sleep brainwave on for 20 minutes. She fell asleep with it. You wake up, you take it off. She literally went from 5-minute average of deep sleep a night to 2 hours of deep sleep. So again, just something, if you're interested, you'll see my contact information. Brain tap was huge for us for that psychological component. From a regeneration musculoskeletal component, again, we utilize probably a lot of the things that you all utilize. My manual techniques are huge. We use cold therapy, we use contrast, compression. Again, I use a lot of myofascial decompression. I use a lot of instrument-assisted soft tissue and dry needling along with my recovery. It's just what that individual athlete needs. But the beautiful thing, like Angela described, is that you're going to see that now, instead of just doing a deep muscle flush after a practice or after a game, your soft tissue, whatever those techniques you're utilizing as the athletic trainer, as a physical therapist, as a massage therapist, think about those benefits now that we can add in utilizing the WinBack, utilizing this TechR therapy. So here you'll see, again, we just have some videos. It's not specifically what I did, but it's just so you can get an idea of what this is. The CET model, as I described, the first one is going to be addressing the muscle tissue right up underneath where he's massaging. So whatever your massage technique is, you can utilize the, in this case, the CET application. They're getting that heat because he said I got it set at 40%. He's getting that benefits of that heat and that circulation. Now, here we have it set at RET. So I talked about that's more resistive, so it's going to be deeper, but it's still set only at 10 to 20%. So your intensity is still going to be microcirculation. You're going to get pain, but it's going to be affecting in here that resistive tissue, right? It's going to be that there's that plantar fascia, it's the calcaneus, but you're getting that deep heat. They're getting that sensation of just a light heat because it's low frequency or low intensity, but it's affecting that circulation, that O2. And again, here he's going over deeper tissue with that RAT, so not getting as much in the beginning. You do it for the muscle, but now with it set at that RET, we're getting more of the deeper tissue. We're going to get down to the ligamentous structure. We're going to get down, if we're going over the Achilles, to the Achilles tendon structures, to any of the joint capsules. So somebody, you know, maybe post, you've got a lot of stiffness through your IT band and up through that fibular head, and you want to work some mobilization. You're going to be able to do that with the additional comfort of the anesthesia, the heat, the microcirculation. And so what I ended up, what Angela talked about is my athletes were saying, hey, when you do my massage, are you going to have that, are you going to do that thing again, that heat? It felt so good. And then the next day, as far as their recovery, was incredible. So a huge component of how you can incorporate this into your recovery regeneration programs. So before I jump into my next example with acute ankle sprain, Tracy, are there any questions that have come up specifically about recovery programs or further about WinBack on those?
Yeah, we actually have a Bucks fan for tomorrow in the athletic training world. Asked if you can actually feel a difference in the tissue when you're using the device.
So when you're using the device, was that the therapist feel the difference in the tissue? Is that what they're referring to?
I think they're referring to, can you feel a difference? Can therapists feel a difference on the athlete?
Yes, and so similar to what you're manually feeling, for example, you'll feel the manual effects, but you will, depending on how you set up, you will also, as a therapist, feel that TechR, feel that heat component. You will feel that whether you have it going through your hands, which you'll see some different examples of that coming up here, or whether you have it through your hands directly or through the equipment provided by WinBack. You still will also feel the heat in itself.
Okay, great. And then we have another one from another Bucks fan. I think there's some Bucks fans on the call today. Can you use iStim with WinBack?
Yes, absolutely. And you're going to see an example of that. You can either use the tool, and you'll see this coming up quickly here with the ankle. You can use the tool that you can get with WinBack, so it's directly attached to the high frequency energy. Or for me, I'm a Hawk Grips user, and so you can put the TechR therapy into my hand while I'm holding the tool, and it'll be transferred through my body into the tool, into your athlete's soft tissue. And the same goes for if you do myofascial decompression cupping. I can either have it attached to myself, and or I can put it stationary. So if I'm doing some cupping, maybe through a quadriceps or through a gastroc, I can put that technology on, and then I can the WinBack on place, and then I can cup between. So you have the energy of the WinBack happening, and then you're going to have that your cupping, your myofascial decompression happening at the same time.
Laura, can I just on one of those questions regarding, you can feel the heat, but I don't know how you find, but you also find the tissue, if it's tight or whatever, releases a lot quicker when you're using the TechR combined rather than on its own. So you definitely feel the effects of the radio frequency while you're working as well.
Absolutely, great point. All right, so we'll go ahead and we'll be able to see some of the examples of the questions that just came up, Tracy, and maybe field some more of them after we go through this example. So the second injury that we we had this the second day of training camp. Of course we knew that after coming out of the bubble, you had not been able to train for 3 or 4 months. Then we got to Florida, had to go into our rooms for 3 days of straight quarantine, just food delivered to your door. Had to figure out the best way the athletes could do. They were kind of prepped going into their room with bands and dumbbells to work out in their hotel rooms. Then you were released, as we put it, on that Friday, and we had 10 days of training camp to get in shape, and then immediately on the 11th day our regular season started. So we knew what we were up against from an injury perspective. And of course, second day into our training camp, we had a high ankle sprain from an athlete who had a history of high ankle sprains and history of lateral ankle sprains throughout her collegiate and professional career. So here's, again, what I had was 7 days to get her from that acute inflammatory phase all the way back to be able to play, hopefully start our regular season so quickly. But then in the back of my mind, this is somebody that has had these ankle sprains over and over throughout her collegiate and professional career. How can we not have this happen again? You know, she's been through a lot of great ankle rehabilitation programs. What's that X factor in why she, her tissue is not getting to the level that she continues to re-sprain or re-injure that ankle? So again, these are not the techniques that specifically that I use in the bubble, but there's some great videotape of techniques and the same philosophies to start out with. So the first part that we're going to talk about and see here is dealing with that inflammation, that acute inflammation. Instead of just putting, you know, ice and compression, which again, I'll date myself back to early 2000s with Arnie Kander and the Detroit Pistons, where I learned to move away from that and move people through physiologically the healing process of what can I do to give that best healing environment internally for that soft tissue. So we start out again with that whole idea of I want to decrease swelling. So in this case, we're using this deep CET. It's a vascular, it's stimulation, and we're going to go right in the back of that popliteal fossa. So this would be similar to if you're opening up that whole lymphatic system and you're doing, you know, fascial release to open up that whole lymphatic system to take out any inflammation or get that any swelling moving. First proximally, and we could even, you know, demonstrate where I also did it up into the inguinal area to open up those lymphatic drainage areas. So that's your first thing, instead of, again, just ice and compression from a cellular perspective. And now we're going to go into, still in this acute, we're still in inflammation. We want to get through this inflammatory stage as quickly as we can to that proliferation stage, to those fibroblasts. So what we want to do next is to take the CET and go over some of the soft tissue here. Okay, so now we have that soft tissue. And wherever your massage techniques are working, this is what we're going to be working on. And then finally, you'll see you take it into this RET mode. And again, now it's still at this low pulse. So it's still really light. It's not going to be a heating effect. This is more that physiological effect. And we go over those ligaments. So we talked about the RET is going to focus more on the ligamentous structure and more of the healing with that ligamentous structure. And also what else in this case, the calcaneus. But we think about the periosteum and you think about the deltoid ligament, you think about all the ligaments attaching to that calcaneus. So if we're to keep creating this physiological process into the ligaments, the periosteum of the bone, all right, and now, as we're going through this ankle rehabilitation, that's where we'll start. We'll start with that acuity, right, when the inflammation. Then add our next step, as we talked about with the physiology, is get into that proliferation of that soft tissue, or take that collagen tissue to the proliferation to start to get that type 3 collagen. But we know that type 3 collagen is not what we want to stay there. And I suspect that's what stayed in this athlete's ankle, because she rehabilitated it, but never got back to that type 1 type of collagen, never got it back to that full stiffness state of what we need in a ligament. So that includes then the next part, from our manual therapies to our active movement. So here's just some examples of what you can do on that end. All right, so you can see here now we have this bracelet, which we'll see a little bit later and talk about. It doesn't just have to be the electrode that we're working with here and doing this massage like we saw before. Here's the instrument-assisted soft tissue we alluded to. You can use this tool or you can use your own tool, but think about that utilization. We'll talk about it. How about mobilization being so important after an ankle sprain? And then getting into movement, where you've got the Tech-R therapy on while they're gaining their range of motion, their dorsiflexion, while they're doing exercise, while they're doing strengthening, eccentric, concentrically, ecocentrically, and while they're doing proprioceptively. And again, Angela alluded to the fact that in these, we're going to get that physiological effect, that connective tissue effect. And that last example is just a great example of when you're working on trigger points and being able then to have that physiological effect of the Tech-R energy while you're working on those trigger points. The uniqueness of that Tech-R, so I can have that band on, as you just saw that video, and I can be doing an ankle mobilization and have that energy warming the joint capsule, because I've got it set on RET. So they feel the warmth. It's decreasing their pain, so they're not guarding against you getting that increased mobility that we need within that joint capsule. So this is, again, just far beyond just, getting a feel-good massage with it. You're actually attacking it from the mobility perspective, or in the case of that, even that ankle sprain there, going over the ligaments that were involved. So, we've learned in instrument-assisted soft tissue, we can help remodel from that type 3 collagen that happens during that proliferation to that type 1 collagen that we want in that remodeling phase. We can do that with the tools, but then think about the added benefit. If we've got that Tech-R energy that Angela talked about, you're going to even get a better remodeling effect. And here's another physio just demonstrating some other techniques of mobilization and how you can incorporate this manually into your treatment program.
Well, we had another
one that I really love with this is when I'm working that posterior glide, trying to get that tailless and that posterior glide perspective. There's so much stiffness in that calcaneal area right in here, in that posterior calcaneus, and in that junction between the Achilles tendon. And so if you can get that Tech-R energy back behind that area while you're doing your dorsal glide, it really is comfortable, and you can really get great gains, right in this region. And you can see him do the mobilization. You can do it through your hands. So he's got the energy going through his hands right there. And then you can work that area as you're mobilizing. You saw him earlier working right over the ligamentous structure. So you can do his cross friction over those areas. And you're getting your manual therapy, whether you're using a tool, whether you're using your hands, but you're also getting the positive effects of that Tech-R energy. So before I jump into this, this next example, Tracy, are there any questions out there?
Yes, I'm glad you asked. We had 2 Kansas City Chiefs fans, athletic trainer and a PT, both asked what? Can you hear me, Laura?
Hi, everybody.
I think you muted yourself. Can you hear us, Laura?
Hi, Tracy. I'm here. If while we wait for Laura. Laura, I think you're on mute.
Sorry about that. Am I on now?
Yes, can you hear
Sorry
us?
about that. Sorry so much. Are there any questions out there? Sorry about that.
That's okay. Yes, yes. There's actually two people were inquiring about what the therapist or the clinician feels with the bracelets on the arms while they're treating.
Very similar to what and again, Angela, you can chime in here too. Very similar to what I alluded to earlier. So you will feel some warmth through your hands, through your forearms, mostly through your hands, as you're providing the soft tissue. So you do feel some warmth also.
Great. And then I had another one come in from a Bucks fan. I have to add these in because I'm a huge football fan. Did Laura use win back with every player?
That's a great question. And you know, I'll premise it by no, I did not. It always goes back to whether it is their recovery program, whether it's their rehabilitation program. Everybody's is individualized. And I would, at this point, I want to say that in the recovery program, for my athletes, I had 11 athletes there. We're a small roster in the WNBA. Of those 11 athletes, 11 consistently had the TechR in their recovery programs. So 6 of the 11 consistently had it. And then in the rehabilitation programs, 50% of the players had it as part of their rehabilitation programs. So I would say it was used at least 50% of the time.
And another question
one
is,
of the problems, I'm sorry with that, Tracy, one of the problems with that is, unlike Angela, I only had one unit for the 2 of us physios that were there.
great. And then another question that came in is, what is the player's feedback on the win back treatment?
Yeah, and again, what I experienced was similar to what Angela had said with her patients, is that once we incorporated it into their recovery massage, they requested it. They wanted it as part of their recovery program. Same thing with my ankle sprain athlete. Once I started to implement it into her ankle sprain, then she saw the other athletes were also getting it as part of the recovery. She requested it. So they actually requested.
Great. We have a couple more, but let's go ahead and move forward because I know we're kind of reaching time here.
Yeah, that sounds fantastic. I will get into the last example, which is this was an athlete who I think a lot of us have had these athletes on our teams and in our organizations or our training rooms. This is somebody who's had an ACL injury, a very experienced professional athlete, was an Olympian in the league for more than 10 years, and had an ACL injury 2 years previous. She actually had a quadriceps tendon repair done. And this was 2 years later now, and she had not recovered fully and gotten back onto the professional level basketball court where she was previously playing at. And she had to have a follow-up surgery to release a lot of scar tissue on that superior patella pouch region. So again, somebody that had been playing a lot of years, DJD was present in all 3 compartments of her knee. A lot of soft tissue restrictions for both flexion, extension, and tibial internal external rotation. Range of motion problems that not only were at her knee, but like many of our athletes, associated also down at the foot and ankle, up at the hip. Strength issues that were residual from her original injury post-operatively that were never recovered from, but then of course all those adaptive patterns that they pick up and create those muscle imbalances that then show themselves on the basketball court from a performance perspective. So here was my problem list, coming into the bubble, and she was going to be a starter for us. So again, the beauty of the bubble was that we had these athletes 24/7. They couldn't go hide from you and get out of rehabilitation. So the first thing that we started to work on here was range of motion for that knee. For me, that's, I can't gain strength until I get some decent mobility. And as soon as I get some more mobility, I'm going to put strength into that mobility. And as soon as I get more mobility, I'll put more strength into it. So that's just one of my philosophies. So we started there with the range of motion. So just want to show you a video of some examples here. And again, range of motion. So he's got this set up at this RET to start out with. So it's going to affect the joint capsule. So as I'm thinking about this, this is all warmth that they're going to feel, not just superficial at the skin level. This is when you look at the thermal effects and you look at thermal studies, this is affecting the joint. So you can do your internal, external rotation, your mobilization, working on flexion. It's going to affect what else? That patella tendon right there. Then as we switch it over to the CET mode, you can really emphasize the superficial structure. So now this is the higher water content muscle. This is going to be your quadriceps area, your suprapatellar pouch that we're emphasizing here. And again, they're going to feel that warming effect. And here we're using actually one of the attachments, the CET attachment. We can also later on, you'll see us just use our hands for the same type of treatment. Right here, the bracelet goes on. And now that Tekar energy is going through the physio's hand right to that soft tissue. And again, whatever your manual techniques are, you're just going to employ them into this area. We're thinking about all of this. This is all the connective tissue. We're using a little bit deeper heat. 20 to 30% is going to create this circulation. Another example now, you talk about instrument-assisted soft tissue, of using your instrument-assisted soft tissue while at the same time having that high frequency energy and the positive benefits of that to that connective tissue, going through your hand to the tool to their soft tissue. And you got to follow it up with active motion, right? And so you'll see the benefits. We saw everything manually being done. Now you can use the same Tekar energy with these, removable, these stationary pads, and you can do active movement. You can add active range of motion, muscle re-education, plyometrics with it. And so it's not just about that manual, as Angela alluded to earlier. It's from the acute inflammatory stage all the way to the end of rehabilitation that you can include this. So again, our initial treatment was really based off of that manual component, and utilizing those tools, utilizing cupping to release a lot of our soft tissue. But you can do the same thing as this picture just shows. We can have it stationary set up with, again, the Tekar going through from focus through her knee, because it's set up in a stationary pad at her gas drop there. And then you see it up on top of at her abdominal area, just above her hip. So she's going to get that Tekar energy all the way through her knee to her hip. But I can be working the soft tissue at the same time. And for my athlete, she had a lot of adhesions along that biceps femoris attachment, and that glide between that and the between that and that whole IT band. So let's look at another video here, and this just really gets into how we can get that functional component of your whole functional massage going, a little different techniques. All right, so again, you'll just see a different therapist techniques, but getting that same emphasis. If you're into some of the mulligan techniques and you want this to be able to do some of the mulligan mobilizations, you can do that. Right here, you can see some mulligan mobilization for that medial meniscus, and he's got it set at that RET, so it's going to affect those dense tissues. So you're actually going to get to that cartilage tissue and get some heating effect right into that medial meniscus. Or in this case, you can see both hands utilizing it for that IT band release. Because that IT band is that stiffer, denser material, we're going to use that RET and be able to get down there while you're doing your releases to all your different soft tissues. So I know these are quick videos, but you can just think about start your clinical application, and your brain just starts to go on how I can accelerate that healing process. And then as we got that mobility restored within that athlete, of course, we talked about there were those strength deficits, and what were we going to do with those strength deficits and get a little more specific. So let's just take a look at some more exercises and different things that you can utilize during this with the wind back. So you can use it for, during your active stretching, or even you think about if you do your neurodynamic glides. So my athlete had a lot of, core issues. So now you're getting not only that core training, but we're going to think about, you're going to be able to get that connective tissue healing physiology through that high frequency energy. And in this case, he's standing on that plate. So it's going right through ankle joint, knee joint, hip joint. So if they have pain, it's helping with that analgesic effect. And that's also proprioceptively assisting with that connection, again, between the brain and that connective tissue. There's that neurologic component. As we alluded to also, it can really be easily incorporated into pre-practice stretch, pre-game stretch, instead of putting a hot pack on. Because as Angela alluded to, again, in that physiology, it's a much deeper heat. So it makes a lot more sense to set this up and have them do some of their stretching and some of their mobility work with this on, as opposed to using a hot pack before practices or a game. Again, it just became an adjunct. Of course, with this athlete, I utilized a ton of the BFR on our off days also. But on those training days where sometimes I didn't, you can't fatigue that athlete with that BFR, having that TechR as part of their exercise program and their strengthening program and their proprioceptive program, huge benefit. So it's all about the results, right? It's all about the end range. So at the end of the day, not only did she make it through the whole WNBA season, not missing one practice or one game, she actually statistically had the best season of her career in the WNBA. So you meet both those goals. So Tracy, I'm gonna bring it back to the group and have some interaction.
Great, thank you. We have a few questions, and I know that we're kind of running over on everyone's time. So I'm going to throw a couple at you and see what you'd like to answer. And, again, anyone who did send in questions, we will answer your questions after the webinar, sending those responses to you. But a couple of the questions were, what is the treatment time? Can you attribute the success in the bubble to win back? Was that the only variable you changed? And I'm going to give you a third one, and you can decide, and then the rest we'll answer offline. Does Laura feel that the win back enabled players to heal quicker and better?
So I'll take the last two, and then I'll give the first one back to Angela, if that's okay. So did I feel that the last two kind of go hand in hand. When I talked about my rehabilitation, or when I talked about my rehab system, the only thing that I changed two things from 2020 to 2021, or three. You're always smarter each year, so that was one. But we were in a bubble, so that I guess they take that factor away. The only technology that I changed was adding win back. I still did everything else that I had previously done. I still had laser, I still had shockwave, I still had the manual techniques that I had used previously. So that was one thing that I changed. And the only other thing that I added that was different was what I talked about from a psychological standpoint, was brain tap. So did I feel like it helped? Man, I just have to go by my gut feel says it helped. The athletes felt better. And then I guess the proof is in the pudding, in the fact that we did not have a major injury during the regular season. that we missed anything. So, you know, including if you think about that ankle sprain, not only made it back in time for regular season, but knock on wood, has not re-sprained since. So were we finally able to take that to that collagen tissue of that ankle from that type 3, where maybe it never really changed from type 3, from that proliferation? Were we able to take it back to the tensile strength of that type 1 collagen? You know, before I did instrument assisted soft tissue, I was doing laser and different things. Did WinBake make that difference? I don't know. But, you know, everything else was the same other than WinBack in the brain tap. Angela, you want to talk about treatment times for us?
Yeah, I can do. So in terms of treatment times, it's a bit like anything we do. What are you trying to achieve and what effect are you trying to get? So, I mean, the WinBack is set up, you usually, again, the size of the area you're treating, that sort of thing. So if you were going to do a massage for that length of time, so it was 10 minutes, you then could combine the CET with that, or the RET for up to 10 minutes on it. Again, if you were treating an acute ankle sprain, you wouldn't be spending 10 minutes in that area, might be 1 or 2 or 3 minutes. So that's where it's really quite good, in that you just add in what you would be doing and the length of time you'd be doing. You're just combining the WinBack with it. I would say the only thing is that the treatment times can be up to 20 minutes on the machine, but you can adjust that. And generally, if you look at a normal treatment as such, if you're going to work on the muscle tissues first, you'd maybe spend a few minutes working with the CET on that first, then you go into the RET. And do, depending what you're doing, if you're doing your manual therapy first and then your exercise. So it depends how long your sessions normally are. And like I said, what are you clinically wanting to achieve anyway? So it depends. For me, if I'm seeing a patient and I'm going to first do some tissue release and then mobilizations and then exercise, it could be 30 minutes in total. But there are various different permutations of what I'm using. I'm not using the same thing all the time. I might have used the CET electrode, and then I may have used the fascial tool, and then I may have used the strap-on electrodes to do the exercise. So yeah, I don't know how you feel with that, Laura. Are you the same as that?
Yeah, I ditto that. It might be as little as 10 minutes, or it might be as long as 40 minutes if I'm doing a full flush on both legs.
Yeah. Anything else, Tracy?
Well, I think we've gone quite over on our time, and there are a few more questions, but you know, we will absolutely answer those after the webinar. Thank you everyone who stayed on. I'm looking at the numbers and everybody has stayed on and you know, given us the extra time today. And a huge thank you to both Laura and Angela for helping us with this. I mean, I am thrilled to be a part of WinBack and thrilled to bring this new technology to the US. And you know, it's something that is really, I think it's a real game changer, and it's exciting. So it's even more exciting hearing all the success stories that we have. So again, thank you everyone for your time today, and we will address the questions. If anyone has any additional questions, our contact information is on the screen right now, and we're happy to reach out to you and answer those and to provide any additional information. So thank you again, ladies. This has been awesome, and I look forward to our next endeavor.
Absolutely. Again, thank you everyone out there. And please don't hesitate to reach out to either Angela or myself for more information on our rehab systems, you know, what we do as therapists, and we would love to learn from everybody out there in the audience too.
Thank you, everyone.
Great. Thank you. Have a great Saturday. Super Bowl.